Hello, it's Monday, it's 9:15. I'm Joanna Gosling in for Victoria. Welcome to the programme. A recruitment crisis in the NHS with tens of thousands of nursing and doctor posts unfilled. Hospital workers tell us the impact it has on them.
My name's Dr. David Rouse. I'm an emergency medicine registrar and I'm concerned about the number of doctors that are leaving A&E and leaving the UK.
I'm Reena Aggarwal and I'm an obstetric registrar. I've just finished a night shift this morning and what concerns me is the sustainability of the medical workforce in the future.
I'm Harrsion. I'm a senior staff nurse in A&E and I'm concerned about the number of nurses leaving the profession and the impact on the NHS as a whole.
First this morning, a recruitment crisis in the NHS. More than two-thirds of trusts and health boards in the UK are actively trying to recruit from abroad as they struggle to cope with the shortage of qualified staff. Tens of thousands of NHS nursing and doctor posts are vacant. The figures obtained by the BBC show that in December of last year, the NHS in England, Wales and Northern Ireland had more than 23,000 nursing vacancies. That is 9% of the workforce. More than 6,000 doctor posts were also vacant. That's 7% of the total workforce. Comparable figures for Scotland were not available. Many hospitals in England are having to rely on expensive agency staff to make up the shortfall, and that is part of what's driving a financial crisis within the health service. Well, one solution is recruiting from abroad. The figures show that more than two-thirds of trusts and health boards across the UK are actively seeking staff overseas. The Royal College of Nursing and the British Medical Association blame poor workforce planning. But the government says since 2010, more nurses and doctors have been working in NHS wards. Well, what impact does this have on those working within the NHS and also on patients? Dr. David Rouse is an emergency medicine registrar and deputy chair of the UK BMA Junior Doctors Committee. Dr. Reena Aggarwal is an obstetrician and gynaecologist, just finished a 13-hour night shift. And Harrsion is a nurse who works in the A&E department of the Royal London Hospital in East London. He's originally from Ghana and trained in this country. Thank you all for coming in. Reena, first of all, we'll start with you because you've been up all night working. So tell us about the impact where you're working of staff shortages. Is it something you are aware of?
I think you can't work in the NHS and not be aware of the staff shortages, whether you're a doctor or a nurse, like Joe is. For example, so last night on my own labour ward, we were 2 midwives short. That's quite a common occurrence across the country and in my own hospital as well. And in terms of nurses as well, I often see shortages of nurses on the wards during the week as well as on the weekends. In terms of junior doctors, and yes, there's a huge shortage of junior doctors. There are rota gaps ubiquitous across the country. In my own hospital last year, between April and October, I worked a 14 registrar. I was on a rota of 14 registrars. We were 7 registrars down. I was one of 2 full-time registrars that was working that rota. So on top of my ordinary shifts, I worked extra shifts between April and October. By the time September rolled round, I was so exhausted, I was so burnt out, that actually at the time I was considering reducing my shifts or actually giving up the profession. Thankfully, I had a holiday, I had some sleep, I got some perspective, and I remembered my vocation and why I love being a doctor. And I'm still here and I'll carry on. But this is reality. The rota gaps are driving doctors out of the NHS. They are causing burnout, and it is a real issue for sustainability in the future.
And what about the impact on the patients and the care that's being
Well,
provided?
obviously, that has a huge impact. If you've got tired, demoralised staff, that is going to have a huge impact. For example, yesterday, just the real impact of having 2 midwives down means that care has to change. You know, patients have to wait. So we had women on the antenatal ward that needed to be induced. They're stable, but we had to delay that because we had other emergencies that we had to deal with, and because we don't actually have the staff to be able to treat those women or care for those women. You know, there are shortages now with the NHS is facing a financial crisis, and all hospitals are being asked to look at their wage packets, and as a result hospitals are reducing the amount of nurses that are on the floor. and that impacts care. So, for example, we have a triage service in my own hospital, which used to have 2 midwives, 2 full-time midwives that used to staff that. Since December, that's only been 1 full-time midwife that staffs that. So therefore, obviously, the same number of women are coming to visit us. That means women wait longer. That means that impacts patient care. That means potentially it impacts patient care.
Joe, you're a nurse in A&E.
Yes.
What's it like for you?
I'm not a political person, and I don't want to say this in a political arena, but I think as a nation, if we're not healthy, we can't go to war. The impact on the nation as a whole is that, you know, when nurses are dealt a raw deal, they do leave, and it's the patients who actually do suffer. So
on a daily basis where you're working, are you aware of shortages?
Oh, absolutely. I mean, a lot of nurses are leaving. Within a space of about 6 weeks, we've had about maybe 10 or 15 nurses leave because they're not getting the tools that they need to nurse the way they want to nurse. And so, therefore, the best thing for them to do is to leave.
And so explain then the impact of that on the department.
I mean, really, it's patient care, service users care. And that's the impact that actually, really, it's so terrible. I mean, the impact is terrible. You're not giving the resources you need to give optimum care. And so, therefore, patients who come in actually get the brunt of these shortages.
David, you work in A&E as well.
Yeah.
And you represent junior doctors with the BMA as well, so you have this sort of overview. What's your perspective from your personal experiences and why it is happening?
So from my personal experience, I mean, we're looking at emergency departments where the numbers of patients attending is skyrocketing. We're seeing 17–18% more attendances now than we did last year and the year before. And this is impacting massively. We've got rota gaps throughout the country in emergency medicine, and we're struggling to fill and recruit doctors to emergency medicine. And I think the two are linked. You look at the number of people who are attending, then you can see that people get burnt out because they just can't cope with the amount of demand that's been put on them. And this isn't just for emergency medicine, this is across the whole spectrum of specialities, and not just medicine, also nursing, physiotherapy and other allied health professionals are really feeling the brunt of the strain that's been put on the NHS at the moment. And I think when you look at that and you think that doctors and nurses are getting burnt out, they're voting with their feet. I mean, this has been demonstrated by the fact that junior doctors going forward from foundation years, which is the first 2 years after qualification, 50% are choosing not to go into specialist training at the moment and are either going abroad to Australia or are choosing to leave medicine altogether. That's compounding the problems and making burnout more likely. And then on top of that, we've got the government choosing to impose an unfair contract on junior doctors. At a moment when staff are the most demoralised they've been in decades, it's not surprising that doctors are leaving the country.
We wanted to get somebody from the government on. Unfortunately, they were unable to put someone up. But what they do say is that there are more nurses and doctors in the NHS than ever before. There are 29,600 extra clinical staff since 2010, of which there are more than 10,600 doctors and 10,600 nurses.
But you've got to look at those numbers and think the government are removing bursaries, making medicine and nursing inaccessible to students because it's
very expensive. But they're saying in real terms there are more clinical staff.
But if you remove the amount going in and you see more leaving, then and the demand is increasing, then whether or not they've got more doctors or whether they're saying there are, what we're seeing is that people are leaving in their droves. So that number doesn't stack up for what we're seeing on the shop floor.
Yeah, it's like putting new wine into old wine skins. You know, the same problem would repeat itself. I mean, we saw this in the mid-2000s where nurses were and other healthcare professionals were brought in from different countries like the Philippines, Zimbabwe, and they've left in their droves, you know, because I mean, it's the same problem.
So what I'd like to say is the government does say that there are 10,000 more doctors since 2010, and they probably are, but And what David has been saying is that the junior doctor contract particularly has created such negative publicity, particularly in the last 6 to 8 months, that actually medical school applications are down over the last 2 years, and statistics show that they're almost 15% down. So young 17 and 18-year-old people, kids who have always wanted to be doctors are now looking at the NHS and looking at the government and saying, looking at the contract and are not choosing to do medicine.
You said, Reena, that you had to remember it was a vocation at one point. Do you all feel like that?
Yeah, I chose to be a doctor when I was 4. That's when I decided I wanted to be a doctor, and I've only ever wanted to be a doctor. I've only ever wanted to work in the NHS. And over the last 8 to 10 months with the junior doctor battle, and we all understand the NHS is under huge strain. We're the frontline doctors. We do this every day, frontline nurses as well. We accept that. We take the job as it is, but the current rhetoric is really causing us to think again.
I think what you've got to realise as well is these are people in the majority who are not leaving medicine. They're choosing to stay with their vocation, they're choosing to be doctors. They're just not choosing to do it in the NHS.
Yeah.
And I think that speaks volumes.
Yes.
Thank you all. Jason on Facebook, look after the staff. When we've been in for treatment, they work till they break. I've seen them stay beyond their shift to help out. They're so busy they dare not take a break. I've seen them eat in the toilet as they felt guilty for taking a break. I couldn't do their job, so do look after them. Thank you all very much for coming in. Keep your thoughts coming in.